Kalimera. I'm very honored to be here. Thank you for the organization to invite me. I think it's my first keynote speech in my life, probably meaning that I'm getting old. What is nicotine? Nicotine has been demonized because people used to take it with smoking. Not in the very old age, but smoking, and particularly smoking cigarettes, is quite recent. It popped up very much at the beginning of the 20th century. Nicotine is actually a substance that was developed by some plants in order to get protected from insects. It's an insecticide, natural one, and it's very common. It's very common in many plants that we eat every day. Tobacco is from the same family of plants as tomatoes, potatoes, chili, peppers, and so on. So all these plants have nicotine in it. Nicotine is an alkaloid, like caffeine, cocaine. In chemistry, the end of the word is meaning something. It's a simple and small molecule, and it's too small to trigger the immune system. Nobody can have an allergy to nicotine. There are plenty of other alkaloids in tobacco, but nicotine is the major one. And it's in tobacco that you can find the more important quantity of nicotine. And that's just why we use nicotine from tobacco both to do nicotine replacement therapy products and also to make vaping liquids. What are its effects? Nicotine is a psychostimulant. It's pretty much like caffeine. And it helps one to focus attention. Nicotine acts everywhere in our body. We have nicotinic receptors everywhere, including the digestive tract. This is very well known from smokers. In the morning, they take coffee, a cigarette, and they go to the loo. Its immediate effect, the most noticeable one, is on heart rate. But something many people forget is that these are acute effects of nicotine. During the day, the effects are slowing, diminishing. And a smoker or somebody who uses nicotine has a tremendous tolerance to nicotine effects. So the first cigarette in the morning will have a quite high increase of heart rate, but after the second, the third cigarette, there will be no change during the day. The problem of tobacco is not nicotine, it's not even tobacco, it's combustion. It's the fact to burn a plant, whatever plant you use. When I talk to smokers, I told them, you could smoke dry lettuce. You will have exactly the same toxic in the smoke. You will have tar, carbon monoxide, particulate matter, and so on. So the problem of tobacco smoking, it's combustion. And remember that nicotine is not carcinogenic. There was a big disaster with the light cigarettes that started in the 70s. I was still a smoker at the time, and I lived that period. Light and mild cigarettes can produce exactly the same amount of nicotine to a smoker, whatever the numbers that were on the cigarette packs before we introduced, for example, in UK or France, the generic pack. So we get rid of these numbers, but smokers are still thinking that light cigarettes are less dangerous, which is not true. Because for those people at the left end of the graph, to get the amount of nicotine they will get, because they know exactly how to titrate nicotine, they will need to inhale more smoke, inhale it longer, deeper. And that's why pulmonary cancers in the 50s and 70s were proximal on the higher bronchi, and then get deeper and deeper with small cells and get very difficult to treat. Nicotine is a solution, it's not a problem. People smoke for nicotine, but not only nicotine. There are other compounds in the smoke. And I kind of disagree, and actually Carl Fagerström, who is here, changed the name of his test, which used to be the test on nicotine dependence. The test was renamed as cigarette dependence. Because tobacco dependence, as I prefer to say, is partly due to nicotine, but not only. There are substances in the smoke that are MAO inhibitors, monoamine oxidase inhibitors. These are substances that have antidepressive effects. But the problem is that people die from the combustion, not from tobacco or nicotine. The problem is the smoke. And for example, there is no combustion when you use snus or when you vape. So you eliminate the major factor, the major risk factor. Neil Benowitz, who was my mentor a long time ago, had this sentence. He is a cardiologist, and he said that nicotine is not a significant cardiovascular risk. The problem, again, is not nicotine, it's carbon monoxide, oxidant gases, and so on. And let's briefly talk about the lethal dose of nicotine. There is a big myth here. If you compose all the medical books, toxicological books, pharmacological books, you will see that the lethal dose of nicotine is given to be between 30 and 60 milligrams. And we'll see that later that's not true. And that's partly why nicotine was demonized. So nicotine, but not only. As you can see, the MAO, B, and A activity, which is shown in light colors, green, red, yellow, at the top in the brain of a non-smoker and at the bottom in the brain of a smoker, you can see that MAO-B activity is reduced by 40%. This is like a smoker taking like 40% of an antidepressant treatment. That explains why cigarettes are a very good mood regulator. Let's talk about harm reduction. We have a fantastic example with Sweden. Sweden has a long history with snus. Snus is tobacco. Originally, it was humid tobacco that you put in your mouth between your cheek and your gums, and you get the nicotine through the blood circulation. In 1992, the European Commission decided to ban the sale of this product, which is the safest tobacco product in the world, for one reason, the one that I heard a little bit here today also. What about the kids? We will get kids hooked on tobacco. In 1995, correct me if I'm wrong, Sweden decided to join the European Union and obtain an exemption to continue to sell snus. So Sweden is the only country in Europe that has been selling snus for all these years. And that's in this country today, there is 5% of daily smokers. And that's the country in the world where you have the less pulmonary cancers, and there is the less also head and neck cancers. So despite the fact that people put tobacco in their mouth. And still, recently the European Commission extended the ban on snus. Smokers know exactly how to titrate nicotine, how to take nicotine and to control the dose they take, puff by puff. In this study made in Niels Benoit's lab in San Francisco, which was made at the time of NRT looking for a new indication, which is using NRT before quitting smoking. So you take NRT and you reduce progressively the number of cigarettes you smoke instead of just quitting and putting a patch. So to make sure that it was safe, they took heavy smokers. They gave them 3 patches. Some of them get 3 placebos. Some of them get 1 active patch, or 2 or 3. So up to 60 milligrams of nicotine per day by patch, but they continue smoking. With 63 milligrams of nicotine with patch, they were still smoking, you can see it at the bottom left, 13 cigarettes a day. Some smokers need high nicotine levels. They need that, and you have to consider that also when you treat people with, even with NRT. I mean, everybody who is treating smokers knows that some smokers may need 2 or 3 patches and oral forms and so on. But what you can see in the red circle here is that when they get more nicotine with the patch, they puff less on their cigarettes. They take less nicotine per cigarette. When they have no nicotine in the patch, they took 2.5 milligrams of nicotine per cigarette. When they had 63 milligrams on board from the patch, they took only 1.6 milligrams per cigarette. And on the right, you can see the the carbon monoxide in the blood. And that's when they have the 60 milligram patches, so the white circles, when they have the less CO in their blood. So showing really that when another source of nicotine is bringing nicotine on board, smokers puff less on their cigarette. And during all this, no effect on cardiovascular system. Because again, remember, smokers are chronic users of nicotine. And when you use nicotine, you have a huge tolerance to nicotine effects. And again, also, by inhalation, you have no risk of overdosing because smokers know exactly when to stop. When you smoke too much at night, you have too much smoke, the first toxic symptom is nausea. When you feel nauseous, you just stop smoking. So there is no possibility of overdosing when you inhale nicotine. And that's true also for vaping. Cigarettes are addictive because they bring nicotine very fast to the brain. Pulmonary absorption is faster than an IV injection. That's why crack is more addictive than injected or sniffed cocaine. There is no faster route than inhalation. And because of that, you have a huge peak of nicotine in arterial blood after smoking a cigarette. You don't have that with NRTs. They deliver nicotine much more slowly, so you never have this big gap between arterial and venous blood. And talking briefly about vaping, we are probably in between. Nicotine is acting everywhere in the body, but also everywhere in the brain. It's mainly acting at the cholinergic synapse because it mimics the effect of acetylcholine on nicotinic receptors. But because there are plenty of presynaptic receptors in the brain with nicotinic receptors, that facilitates the release of other neurotransmitters. Nicotine is a neuromodulator. Nicotine is acting on all the neurotransmission, not only on the cholinergic system. That's why it's so difficult to quit smoking. With vaping, it's more slowly than with smoking. This is a study from Konstantinos Vassalinos, which I use very much with smokers to explain them. If you switch to vaping, what you get in 5 minutes with a cigarette, you will have to vape for 30 to 45 minutes to get it. And that's why people say to vapers, oh, you always have it in hand and mouth and so on. It's just normal. You cannot take 10 puffs and wait for an hour. If you wait for an hour, it will be too late. Craving will be here and you will fail. So vapers need to vape regularly. That's why people are telling them that they have it all the time. It's just less efficacious than a cigarette. The lethal dose. So everywhere you will see that it's 60 milligram. But it's not matching with animal data. And when I was in San Francisco with Neil Benovitz, we've been looking for years to find out where these numbers were coming from. And we couldn't find it. Nobody could find it. Until Bernd Meyer, a toxicologist from Austria in 2013, found it. He found it in old books, medicinal books from 1850 or 56, something. So these numbers just came from 3 physicians who tasted nicotine on themselves and just decided the lethal dose, as we say in French, depending of the direction of the wind. So Bert Meyer looked at the literature. There are very, very little cases of suicide with nicotine or even accidental intoxication. And he found that actually the lower limit that could cause fatal dose with nicotine is not 60 milligram, but something between 500 and 1,000 milligram, not ingested because the liver will eliminate most of the nicotine, but absorbed, which makes that we have some cases of people taking 1,500 milligrams or more and having no major problem. They usually go back home the next day. Nicotine has been shown in animals to be safe when inhaled. These rats were exposed to a nicotine aerosol with a concentration that would give twice the plasma concentration of a smoker, of a heavy smoker, and they were they were breathing that aerosol. Thank you. They were breathing that aerosol 20 hours a day, 5 days a week, for 2 years. And there was a group of rats that were just breathing clean air. After 2 years, there was no difference in terms of frequency of tumors, of atherosclerosis, or whatever. They were dissected. There was no difference, just one difference in the end. Those who were exposed to nicotine weighed less 2 years after. Nicotine is also a very good way to control your weight. And that's why it's very useful when smokers quit with vaping, because with vaping, they know how to titrate nicotine, and so they don't take weight. Because when a smoker stops smoking and don't get enough nicotine, they confound hunger and craving. And what they do, they just snack, eat, and so on, and they get weight. When you have a good control of your nicotine by NRTs or vaping, you don't take weight. Is pure nicotine less addictive? Yes, clearly. We go from an addictive substance, which is the cigarette, to a dependence-forming substance, which is pure nicotine. Being dependent on nicotine is not more dangerous, not more a problem than being dependent on caffeine. And clearly, in some studies that have been done in surveys, people are using less and less nicotine with time. And I would like to finish with, well, I've been working on nicotine for 35 years. It's been my only subject for 35 years. And there are plenty of domains in neurological and psychiatric diseases that could benefit from nicotine, either as a treatment or as a tool to better understand what's going on. Because as I told you, we have nicotinic receptors everywhere, and nicotine is a neuromodulator. So all those diseases imply nicotinic receptors. All those diseases could be treated with nicotine. I know it's a bit provocative, but it's been my life. Ευχαριστώ πολύ.